What's going to happen in the future? Will my father become more aggressive or calmer? No. Unfortunately, there is no way to foresee what kind of behavioral disorders your father will develop. But we do have the possibility of foreseeing cognitive losses. Unfortunately, there is no way of knowing which cognitive functions and capabilities of self-sufficiency will be lost, and which behavioral disorders, like anxiety, agitation, irritability, aggressiveness, or trouble sleeping, he will develop in the future. Whenever and whichever of these disturbances will appear, the most important thing to know is that they will be temporary.
This means that even if the aggressiveness is not treated with drugs, it will fade spontaneously and eventually disappear after a period of time that can be short or long, up to a few years.
This fact has very important practical consequences in drug therapy. It implies that if I have to deal with a behavioral disorder and I treat it with drugs, I won't have to prescribe those drugs forever, but maybe for 3, 4, 5, or 10 years. After a few months, anywhere from 3, 6, 9, or 12, depending on other considerations, I'll have to try to gradually reduce the psychotropic drug and see if the behavior disorder comes out again. If it does reappear, then this means that I have to keep prescribing the drug for another while, and that I'll have to try to interrupt the treatment again later on. It may also happen that the disorder doesn't reappear again, and therefore I'll be able to gradually reduce the quantity of drug, which is obviously always the best solution.